Hi everyone, myself Saranya, Assistant Professor from SNS College of Allied Health Science, Coimbatore. Today we are going to discuss a very interesting topic which is called as Laryngeal Mask Airway. Laryngeal Mask Airway is a device, it's a medical device used to support the airway management to the patient. This is used in case of difficulty intubation. So once if the patient is having difficulty intubation or elective procedure or an emergency surgeries, it is meant to use an laryngeal airway masking. And also the patients with an tracheal damage or a trauma to the tracheal region or the laryngeal region, it is helpful to use a laryngeal airway masking. Now I will show the laryngeal airway mask. This is the laryngeal airway masking. You can see a mouth-like structure and you can see two tubes. So this is a dual lumen catheter we are using as a laryngeal airway masking. So it's an advanced one and you will have an inflation line with the pilot balloon. Now I'll be describing a detail about the parts of an laryngeal mask airway. So the laryngeal mask airway will have a very soft cuff. This area is called as cuff. This is inserted into the patient's larynx and this cuff will be positioned above the supraglottic area. So this cuff will be inserted in a deflated manner and once it is inflated, this cuff will be surrounding the area of the larynx, voice box, and it provides a proper seal so that the air can be given in a proper way so it cannot be misplaced anywhere. So for this cuff is used. You can see a hole at the end of the cuff. This is used for a drainage purpose. If there is any gastric drainage or an aspiration, that can be removed with the help of a hole. And you can see another orifice here which is provided for an airway support. And you have a dual lumen here, this one lumen and this is another lumen. This lumen with a reinforced tube, you can see here, this reinforced is present to prevent the kinking. So this reinforced tube is inserted into the tracheal part. Okay. So this reinserted tube with the 15 mm connector is used to provide an airway either through an ambu bag or through a ventilator. And this tube is used for drainage purpose. If there is aspiration in the lungs, it can be removed with the help of that drainage tube. And you can see an inflation line. This thin line is called as an inflation line. This inflation line will have a pilot balloon and then one-way valve. This pilot balloon and one-way valve will ensure proper placement of an airway. And this airway is cuffed or decuffed, can be sealed with the help of a pilot balloon. And we can see the markings here. You can see a markings here. These are the markings that can be managed, that can be seen for the proper selection of a laryngeal mask airway. Here it is mentioned that 20 to 30 kg is an adult for it, you can use this. It's a semi-adult. And it will be marked with an ml of oxygen support needed to be given with the help of laryngeal mask weight. It's almost more than 14 ml of one patient weight. So this weight of one airway will be given to the patient. How the airway is checked is while inserting the laryngeal mask and you are inflating the pilot balloon and the line with the syringe so that the cuff at the end will get inflated and deflated with the help of a syringe. So next one is how you are inserting this and what is the position you are inserting this laryngeal airway masking. So I am inserting it in a direct way so that the hole as well as the orifice of an airway is facing the patient lungs and it's facing the patient's foot. And so this is the pathway for insertion. So I am inserting a laryngeal mask in this pathway so that it is not get obstructed anywhere. And the patient is already in a sniffing position so that you can able to elevate their jaws for further insertion of a laryngeal airway masking. So laryngeal airway masking is also a good technique to support an immediate respiratory needs of a patient. And it can be given in a temporary rates. It's not even given for a permanent one. It is supporting an laryngeal pathway for a temporary respiratory support. And it is used in case of there is an intubation difficulty. If the patient is needed an immediate surgeries, the laryngeal airway masking will produce a good support for the patient. And this one is an advanced laryngeal mask which has a double lumen, and this double lumen laryngeal mask is called as double lumen pro-seal laryngeal mask. Okay. So the laryngeal mask is also a very important devices, so that the advantage of over it, you no need to use a laryngoscope, you no need to use an endotracheal intubation. So it's an very easy method of insertion, and this insertion method will be done by professionals, healthcare professionals who is highly skilled, so that they will not damage the areas of a tracheal region while insertion. That is also a very important thing. And your orifice should not get obstructed. Once it obstructed, the airway will not be passed out in the tube. That is also to be considered while insertion of a laryngeal airway masking.